Hello everybody, Dr. Marianna here from Skin Talk. So today we're going to talk about different stages of aging and how do we introduce neuromodulators like Botox and Dysport into those different stages. So as you know, for me, neuromodulators is just as much an art as it is a science. There's no right approach, there's no similar approach for everyone, and there's no right age to start using neuromodulators. So our facial needs change as we age, and so does our injection experiences. So I'd like to explain the types of wrinkles that we look at and then the 4 different stages that they appear in. So we have dynamic wrinkles, which is basically wrinkles that is caused by the contraction of the underlying muscle. So when that muscle tightens up, it pulls the collagen layer in and then also the overlying skin in. But when it relaxes, the skin on the surface goes back to normal. So that then will progress over a period of time to what we call static lines. So a static line is that muscle that contracts and starts pulling in the collagen in the skin, but then starts the destruction of the collagen layer. And when that happens, we have a permanent groove on the surface. So with our 4 stages, we address the use of neuromodulators a little bit differently. So when to start? So at stage 1 is, if I have to put an age on it, it's maybe in the 20s, and that's when we start seeing lines on animation. So when you frown or smile, you start seeing those dynamic lines show up. Often frown line, crow's feet, forehead lines is the common areas that we would see that first. So when we start early with neuromodulators, we typically need a lower dose or a small dose. But if you start early, you'll need less later on as well. So then going to stage 2, so maybe in your 30s, where the dynamic lines are starting to slowly progress towards static lines and maybe starting to see some finer lines or crepiness show up. So the dose of neuromodulators at this stage is dictated by the strength of the muscle. We know that higher volume of dosages will last longer, but not everybody needs the bigger dose for sure. And then going to stage 3, where that static lines are now firmly getting set into the skin. Sometimes women will complain that their makeup tends to get caked in some of these grooves. And the goal with neuromodulators in this group, in their 40-ish maybe, would be to soften those lines. And then progressing to stage 4 is where we have deep edge lines in our face, and we have to realize that neuromodulators can only do so much, and it's still great for preventing lines from getting deeper. But I also will often recommend that we supplement neuromodulators with other treatments like fillers or plasma or some of our energy devices. So those are the stages, as I said, for introducing neuromodulators. I really hope that helps. And in summary, I always tell patients you can start early. It's never too late to start. And as long as you're realistic as we approach that stage 4, that our expectations needs to be realistic with the neuromodulators on its own. So that's it for today. Please stay around for my shout out. Till next time. Bye-bye. So my shout out today is to tell you about a South African author and conservationist with the name of Lawrence Anthony. He wrote an absolute beautiful book called The Elephant Whisperer. This book is about the life with a herd of rogue elephants in Africa that he was trying to save actually. This is exciting, it's heartwarming, and it shows how he actually became a member of this elephant family. I found this read fascinating and unforgettable and hope that you will enjoy it too. I'll post it on my social media. Till next time, bye-bye.